Hey, thanks for joining us today on Intermountain Medical Center TV. We've got a great topic ahead of us on heart disease and ways to prevent a heart attack and heart disease in general. So I'll introduce our guest here today, Dr. Jeffrey Anderson with the Intermountain Heart Institute. Go ahead and tell us a little bit about yourself today.
Well, I'm a cardiologist here. I'm Associate Chief of Cardiology and also Director of Cardiovascular Research. I also do volunteer work for the American Heart Association. I'm past president of the Western States affiliate of the American Heart Association, and we've been working very hard to help people prevent heart disease. I'd like to put myself out of business if I could before I retire by preventing heart disease, but I think we have a ways to go, so I'm not worried about that yet.
Okay, and February is National Heart Month,
yes,
so it's a
right.
really important topic this month to get into.
Absolutely.
One of the first things we'll talk about, they say it's Heart Month and they want to prevent heart disease. Can you tell us a little bit about what heart disease is?
That's a very good question, and I think it's often misunderstood. You know, the heart pumps every second of the day. It requires a lot of oxygen, a lot of blood supply carrying that oxygen. And they are carried through three fairly small blood vessels, maybe 3 millimeters in diameter. And if those get blocked off, it can cause a heart attack and even be fatal or cause heart failure. And so that's the major thing we're trying to prevent. Now, there are other heart problems dealing with heart valves or with heart rhythm, but I think the major thing people worry about when they think about heart disease is those blocked arteries that cause heart attacks.
Okay. It's a great, very basic understanding of it, so I appreciate that. We are accepting questions on our Facebook page, Intermountain Medical, or facebook.com/Intermountain Medical Center. If you go there, you can ask that. And we do have a first question from Kim. The question that she asks, what risk does obstructive sleep apnea pose to your heart?
You know, that's a great question because we're seeing more and more of this. Often sleep apnea, which means that as you lie back down, you know, the tissues in your throat sort of block off the air channel and make it hard to breathe. And so it can cause snoring or even gaps or pauses in how you breathe. And that reduces the amount of oxygen that gets to your heart, and it can cause heart rhythm problems or over the years may even cause heart attacks.
Okay.
So it's very important to be aware of that, especially in people that are somewhat overweight often, not necessarily, have very thick necks, snore at night, have difficulty breathing, don't feel rested when they wake up. They ought to see their physician, and because there are treatments for that.
Okay, so if they have it, they should see their physician first. If
Yes.
the physician needs to escalate it to a more specialized physician, they can. Is that correct?
We have sleep doctors here that can help out, for example, with certain breathing masks, and weight reduction in a lot of cases will be helpful.
Okay.
Yeah.
Great answer. Thanks, Kim, for the question on that. Again, there are questions. You can submit them on our Facebook page. You can also call in. The number is on the page that you're watching this on. So go ahead and give us a call if you do have questions. If you get a busy signal, go ahead and try calling back, and we'll get to it as soon as we can. So to get started then, as we go through this, a lot of people are at risk for heart disease, but there's things people can do to prevent them. One of the ways that you've identified, as we've chatted back and forth leading up to this, are the simple 7 from the American Heart Association. So let's kind of start going through each of those 7. Again, if you have questions, we'll interrupt that to help answer your questions on that. Starting with the first one. The first one that they recommend in the simple 7 is eat better. Why is it important to eat better?
Well, you know, we are what we eat, and there's certain diets that we've found through a lot of careful study promote heart health, and others that actually promote heart disease.
Okay.
I say follow the F's and shun the S's is a simple way to think about this. So the first F is fruits and vegetables, at least 6 servings, 5 or 6 servings a day, fruits and vegetables. The second one would be fiber, so whole grains, not refined, but fiber. The third one would be fish or other good oils, you know, vegetable oils, at least twice a week, servings of fish. The fourth one would be fat-free or low-fat dairy products. We don't need a lot of the whole milk and high-fat cheeses as we get older. And then, of course, the fourth F or fifth F is fitness, and we'll talk about that in a minute. Okay. And then the S's to shun would be too much sugar, salt, saturated fat, and smoking. We'll get to that later.
Okay.
So follow the F's, shun the S's, and of course moderation in terms of portion size, which we have to watch out for.
Okay.
Yeah.
Some good points there. How does that help you eat? How does eating better help you have a healthier heart?
Well, you know, there's buildup of cholesterol in the walls of the arteries. That's what causes plaques and causes blockage of blood vessels and heart attacks. So we want to reduce the amount of cholesterol that's circulating, and sugar for that matter, that might injure the vessel walls and cause a buildup of plaque. And certain diets help avoid that, and other diets promote that.
Okay. Good information there. You mentioned fish as one of the things. Is there a certain type of fish that's better to eat than others?
Well, they say fatty fish like salmon is a great example, has those omega-3 fats in it that are particularly good, but really almost any fish is helpful, and a variety of fish is probably a good idea.
Okay.
And if one can't eat fish, then there are fish oil capsules you can take and get at the store, but we like it in the natural form if possible.
Okay. All right, and once a week, and what sort of portion sizes on the fish for that?
Well, and actually I would say twice a week if possible, and
okay.
if you sort of take your palm of your hand, that's about the right serving
Okay.
size. Now, other things that have these good oils include nuts, for example, olive oil, for example. The only vegetable oils we think aren't so good because they're more saturated would be coconut and palm oil.
Okay,
Yeah.
two good ones to know. So eating better can definitely help. Tracking what you eat, that's one of the things that it mentions here on the Simple 7.
Right.
Why is it important to track what you eat? How does that really help you in the long run?
Well, you know, it's amazing if you don't think about what you eat, you can get off quite easily. And if you commit yourself to say, what did I eat today? I think that's a good way to do it. Once you get in a habit of always selecting the right things, then I think you're better off. You have to make it into a habit first.
Okay.
So track it into a habit and then check up on yourself every once in a while.
Okay, I like that. Track it into a habit. And there's a lot of apps that are out there that people can go to if they're looking for something that can help them just while they're on their smartphone, because everybody has a smartphone and can go through that. Okay, so track what you're eating and find ways to eat better.
Yes.
Okay, the second element that we have in there is get active. We'll start with the same question. Why is it important to be active to help your heart health?
Well, you know, of course, being active helps your heart to get in a condition, but also conditions the rest of your muscles.
Okay.
So they're more efficient in using the blood the heart pumps. So it makes it easier for heart to supply oxygen and nutrients to the muscles to be active. It also reduces cholesterol, it reduces blood pressure, it does a lot of other things. Plus, you feel better when you're fit. You can do more things. And so we recommend at least 30 minutes on most, if not all days of the week of moderate intensity activity, or if it's really intense, you know, like running or jogging or something very intense, then at least 15 minutes per day to maintain heart health. Now, if you're trying to lose weight, which we'll get to, then you probably need to double that during that period of time. So you have to really, I think, schedule that in to your daily work habits. You know, put it on your schedule, write it down, put it on your smartphone, what you're going to do that day.
Okay.
And it can be a variety of things. Maybe it's walking, maybe it's jogging, maybe it's cycling, maybe it's swimming. You know, the things that seem to fit into your schedule best and that you like the best.
And what you said there, it's what you like the best. Yeah. A lot of people will say, you know, what exercise equipment is the best for me to get? And I've heard people say whichever one you're going to use. If you have a treadmill and you never get on it, well, then it does you no good.
Exactly.
So, okay, good point. So we do have a question coming in. A call, actually. Jess from Salt Lake City. They'll go ahead and got Dr. Anderson on the phone here, so go ahead and ask your question.
Hi, Dr. Anderson. How are you?
Doing well, and how are you, Jess?
Good. So I have a question. When is it time to go on statins? My triglycerides are right on the borderline, as well as low levels of my good cholesterol. Should I continue to try to do more naturally, or at what point do I say I need to go on medicine?
That's a great question. So when do I go on a statin, which is a common cholesterol-lowering medicine? You know, it's interesting that the Heart Association has just come out with new guidelines on how to help us decide. And really, there are 4 categories of people that ought to be considered for statins. One would be those that have heart disease to begin with. Almost all of those should be on statins. The second would be diabetic patients. Most diabetic patients, because it's a high risk factor, should be on a statin. The third group would be those that have a very high cholesterol, and we call LDL cholesterol, not necessarily triglycerides so much. And it may run in families. So if it's over 190, for example, for the bad cholesterol. And then the fourth group is most of the rest of us. We have a risk calculator that's available from the Heart Association that includes your age and your sex and your cholesterol and your blood pressure, whether you smoke and so forth. And that calculates out a risk. And if your risk is over about 7.5%, to have a heart attack or stroke within the next 10 years, then you ought to sit down with your doctor and go through that. So in your particular case, I think it would be a good idea to get together with your care provider and go through that, we say, risk calculator and see where you fit. I think most people under the age of 40 ought to just work on diet and exercise for the most part if they're not in that category. If they're maybe over 75, we don't have as much information and we're a little more cautious there, but between 40 and 75, go to the risk calculator, find out what your risk is, and then chat with your doctor. But certainly a good place to start with triglycerides, for example, would be exercise, diet, and weight reduction, and then see what's left over.
Okay. That was a good question. Thanks for for calling in. If there are other questions, the phone number is on the intermountainmedicalcenter.org/TV page, so you're welcome to call into that. We're also accepting them on our Facebook page, facebook.com/Intermountain Medical Center, and we can respond to your questions that way. So one last question on the kind of get active part before we move on to the next one. It says that nearly 70% of Americans do not get the amount of physical activity they need. If you were to offer to your patients or people watching today, what's the one thing they can do to help them get more physically active? What would that be?
What I think I would say is get a pedometer and put it in your pocket. That'll keep track of your steps during the day. And that'll be a little more motivation to maybe park a little farther away, take the stairs once in a while until the elevator, get up and walk up and down the hall, and see if you can get at least 5,000, but a goal of 10,000, either steps or equivalents, maybe through other exercise, a day, and keep track of it. I think that's the one thing you can do to get started, and you'll be amazed at maybe how much more you need to do. Or if you're doing a lot, you can pat yourself on the back.
Okay, that's a good point. So move on to the next part. The next simple 7 is lose weight.
Right.
It says that 2/3 of our American adult population is overweight, with 1/3 of us in the obese category.
Yeah.
Talk to us a little bit about how weight affects your risk for heart disease.
You know, weight just puts an extra burden on many of the organs of the body. Not only the heart, it has to pump through a lot more tissue, right? But also the pancreas. It's a risk factor for diabetes. Earlier, someone asked about sleep apnea. It's a major risk factor for that as well. For joints wear out earlier. And of course, blood pressure tends to go up with overweight. And you can't do as much. So, you know, we're in an environment that promotes overweight. We have lots of rich foods and lots of things. You mentioned iPad or smartphones that we use that allow us to avoid getting up and doing things. We can just do everything from our desk.
That's true.
So you have to really commit yourself, I think, to watching your diet and getting exercise. Those two things are really important.
Okay. You mentioned that, you know, getting active, eating healthier are ways that you can lose weight. How do you know how many calories you should be eating per day? Is that something you do personally, or do you need to work with a doctor on that so that you know what your intake should be to help you lose the weight?
Well, there are a lot of apps you can get to do that, but basically it depends on your sex. Men use more than women, your size, and how much activity you do. So the more activity you do, the more calories you can allow. But somewhere around 2,000 calories might be an average, or 1,800 to maybe 3,000 if you're very active. But I would just suggest getting one of those apps. And
okay.
I think whatever that calorie count is, you can keep track on an app how much you're eating, and that might be good to get started with. But again, I think in general, smaller portions, more activity, lower concentration of calories, okay. So low fat, low sugar will help.
On weight loss, a lot of people, they want to lose it all and they want to lose it fast. There's a lot of TV shows where it's how much weight can you lose and how fast can you lose it. Is there a healthy rate at which people should lose weight? Is it 1 pound a week? Is it 3 pounds a week if they're doing it right and in a healthy way?
Well, I think 1 to 3 pounds a week is probably pretty good. The problem is not even so much losing the weight, it's not putting it back on again.
Okay.
So if, in other words, a crash diet might get you there quickly, but then if you go right back to what you're doing before, it's going to all come right back on, and the statistics aren't really very good. So the idea is to just get with a healthy diet that you can sustain. We mentioned some of the healthy foods, cut back on the portion size, and increase the activity. And then once you get to goal, just stay right on that diet. Maybe increase a little bit in terms of portion size, but rather than a crash diet. That's what we recommend. Yeah.
So find something that's sustainable so
What's
that
sustainable.
after you like, okay, I've lost 30 pounds,
Yeah.
and it's just going to get right back on if you don't maintain what you're at.
And it's going to be an ongoing, for the rest of your life, you're going to be on that heart healthy diet, not just for a few months.
Okay, that's a good point. We'll go ahead and take a 1-minute break, and then we'll be right back.
Don't get sucked into the vending machine junk food trap. For help, visit intermountainlivewell.org.
All right, thanks for coming back with us. Again, if you want to ask questions to Dr. Anderson while we're here, you can ask them on our Facebook page, facebook.com/Intermountain Medical Center, or on the website that this is being broadcast on. We have a phone number and you can call in your questions if you have those. So continuing on with the Simple 7, we've gone over a couple of them right now. These ones that we've gone through have been more of a lifestyle. The eating healthier, the being active, the losing weight. Now we're going to get into kind of the ones that are more medical, I guess you could say, your cholesterol.
Yes, you have to be tested for that.
You have to be tested.
Right.
What is the healthy level of cholesterol that people should have?
We say that an average normal level is less than 200 milligrams per deciliter, but even lower is better. We think lower is better. And it really depends on what your risk for heart disease is. So if you have heart disease already, then no matter what it is, we want to get it lower. On the other hand, for primary prevention, we allow a little more, but then you ought to look at your family history. Is there a tendency for heart disease? And it's important to know that, part of cholesterol levels are determined by what you eat. We've talked about that. Yeah. And part is by genetics, about how our body metabolizes fats and carbohydrates. So it can generate, manufacture cholesterol. So no matter how good your diet is and exercise are, then you should get your cholesterol tested and see where you're at and whether it needs to come down.
Okay.
Because that's this fatty substance that builds up in the plaque that causes blocked arteries, that causes a heart attack. So we want to reduce that.
And you mentioned kind of at the tail end, you could explain this a little bit more. How does having high cholesterol then cause a heart attack?
Well, the cholesterol circulates in the blood in what we call lipoproteins, and they find their way into the walls of the blood vessels, especially where there's turbulence or injury, and there's a lot of blood circulating through that heart, which is working all the time, and it builds up and builds up and builds up. So it creates what we call a soft plaque, and over time then that can calcify. So we have coronary artery calcium and fibrous tissue, and then it becomes more sort of a complex plaque, and then it might rupture, sort of like a pimple you'd might inside your artery, and that causes a blood clot to form. And then that blood clot may completely block off the artery. That area of the heart doesn't get any blood. Chest pain occurs, and some heart injury then develops unless we open that artery up very quickly. Okay. So going back to the first, we want to avoid too much cholesterol circulating that can get into the artery wall.
Okay. Yeah. Now, you mentioned that 200 milligrams per deciliter is kind of your total cholesterol, but there are two different types of cholesterol. There's LDL and HDL.
Right.
Which one's which, and how do you know kind of where those levels are and how to adjust them as needed?
So LDL is low density lipoprotein, and that's the bad cholesterol. Okay. And HDL is high density lipoprotein, that's the good cholesterol. And so we want to get that low density cholesterol down as low as we can. In fact, anything's not high density non-HDL cholesterol, we want to get that down as low as we can. The high density cholesterol we can increase not through medicines but through exercise and diet. The low density we should do through diet, through exercise, and then in some people, as we mentioned, a statin drug can bring that down even further.
Okay. Yeah. Now, I guess if your total cholesterol is under 200, but you have a lot of the LDL and not enough of the HDL, then you would still need to make some adjustments, even though your total cholesterol is considered healthy. Is that an accurate assessment?
Yes, that's absolutely right. Okay. And so we recommend that your doctor not just measure total cholesterol, but these subtypes, if you will, of cholesterol. Yeah.
Okay, good point. And some of the other things on lifestyle that we've talked about are kind of the ways that you would control your cholesterol, unless it's a genetic thing and you have to get into kind of the statins like the earlier caller had asked about. Is that correct?
That's always the right place to start, is with lifestyle, always the right place. Realizing, though, that in some people, because of genetics and predisposition, that won't bring it down low enough. And so that's why you should get it tested at some point. I think all adults should know what their numbers are and discuss with their healthcare professional whether they need to do anything more besides just lifestyle.
Okay. And how often should somebody get their cholesterol checked? Is it your annual physical? Is it every couple of years? And does age play a factor in that?
That's a very good question, and certainly you ought to get an initial one, and then depending on where it is, if it's just perfectly fine and nothing has changed, and you're keeping up with diet and exercise, you probably don't need to get it done every year.
Okay.
But at least I'd say every 5 years, 3 to 5 years. But then if it's higher, you have risk factors we've mentioned, and you're working on getting it down, then maybe annually or maybe even more than that while you're getting it down with medicines.
Okay.
Yeah.
Good point. So the next one in the simple 7 is manage blood pressure. How does blood pressure play into all of this?
You know, blood pressure is a major risk factor not only for heart disease, but even more so for stroke, high blood pressure. And we can dramatically reduce the risk of high blood pressure and also heart failure, because that heart has to now pump against, a higher pressure load by controlling our blood pressure. And there's some very good, inexpensive antihypertensive medications, medicines to help us with that. But again, we want to know our numbers, and 120/80 is sort of the normal or lower. Then if it gets up to over 130, we have to watch the higher number of systolic pressure, particularly closely, and over 140 is sort of where we think if you can't get it down under that, maybe it's time to think about a medication. But again, exercise and reducing our salt intake can really help with that, and weight control, as we mentioned. Sleep apnea can cause high blood pressure, we mentioned, so make sure you don't have that. So those are some suggestions.
And you mentioned, again, it's back to that lifestyle. If you can change your lifestyle, that's the first place to start.
Absolutely, yeah.
What is, sorry, just looking at a couple different questions here, and I think we've actually answered all of them. So anything else you want to add about blood pressure?
I would say sugar, not about blood pressure, no, that's fine.
Okay. So we'll go on to the next one, which is reduced blood sugar, which is what you were going to go into. How does blood sugar play into all of this?
You know, the most potent risk factor for blood vessel disease is sugar diabetes. Too high a blood sugar just injures the lining of our blood vessels and makes it more prone to develop plaque, and can really be devastating both in terms of heart attacks and strokes and kidney disease. So we want to make sure that we know what our blood sugar is. It can run in families, diabetes, we're talking about sugar diabetes, so being aware of that. There are two types, type 1 that occurs generally in children, and then type 2 is a very common one that occurs as we get older. We put on weight, we don't watch our diet and so forth, and if we have a tendency to that. So we ought to know what our sugar is. Do we have a tendency for it to be high? And again, it starts with lifestyle, watching our diet, watching our weight, getting exercise. But if it isn't controlled that way, then there are medications that patients should work with their physicians to keep it under control.
Okay. And again, how often should blood sugar be checked? Is that annual? Is that at the same time as your cholesterol, depending on what your health levels are?
Yes, it really would be along with that. And again, it would vary a little bit if you have a tendency to it, or you're worried about it, and as we get older, more risk factors for it, probably at least annually. Earlier on, maybe every 3 to 5 years is probably adequate.
Okay.
Yep.
So we'll move on to the final simple 7 that they have here. And this is one you hear about all the time.
Right.
Stop smoking.
Right.
How does smoking have an impact on our heart health?
You know, smoking is devastating to our health in general, not only heart disease, but cancer, disease of the lungs, emphysema, and so forth. And fortunately, we have the lowest rate of smoking here in the U.S., but we're worried that the younger generation is picking up some bad habits, not just tobacco smoking, but there's a new kind of electronic cigarette we're worried about that has tobacco in it, and of course marijuana has other effects that we're worried about, and air pollution. Let's get beyond just smoking to secondhand smoke and air pollution. We need to work on all of those because they can all impact heart disease.
Okay. Now, I've been in some kind of debates or seen this online where people are saying, is sitting the new smoking? Are sugars the new smoking?
Right.
Kind of a short summary on what your thoughts are on that.
Yeah, it's not an either or. It's you need to do all of these 7. And so what I'd like to invite our listeners to do is to check their own assessment out, their own risk score out by going to the website that you have. It's
My Life
right
Check.
here.
Yep.
My Life Check without spaces .heart.org. mylifecheck.heart.org, and pulling it up. Register in and go through it, see where you are on the scale. It'll tell you where you're at, and you can choose your next step, what you want to do, what your goal is, and then where you need to be at. And if you can score well on that, I think that the risk of heart disease is going to be very low, and you'll enjoy an active lifestyle.
Okay. And once you mentioned that to me, that website, I went in and I wanted to take the assessment to see
How
kind of
did you
where
do,
I'm at. So I ended up, so it ranges on a scale from 0 to 10, and I
Right.
had a 7.9. So the 3 areas it says I can improve in is blood pressure,
Right.
being more active, and having a healthy diet. And I can see how both of those lifestyle ones play into kind of the blood pressure. But blood sugar was good, healthy weight was good, cholesterol
Excellent.
was good.
Right.
So that was nice to see. But the thing that I liked about it as I went through it was, like you said, it says this is where you are now.
Yeah.
So my blood pressure is a little off. Here's a list of what you can do on your next step, and you kind of mark the ones that you want to do, and then where you want to be. So it does help walk you through that.
Right.
So it's a free assessment.
Right.
Anybody can take. I think it took me 5 to 7 minutes to go through and look at everything and print out my results. And then you can take it multiple times, is that right?
Yes.
To monitor yourself over time. So it's not just a
Exactly.
one-time, okay, 7.9, I'm okay. Check it again in a few months, see if some things have changed, if I've
Exactly.
improved or, okay.
So I'd say, 5 to 7 minutes can save you a lot of years in life. So
Okay, it's a good point. So I would recommend checking that out so that you can see where you are at with your heart health. And again, the website is mylifecheck.heart.org. So as we wrap up today, we appreciate everybody who's kind of tuned in to this today. What would be, your top, we've listed 7, so we're not going to go through all 7 again. What would you say are your 1 to 2 key takeaways for everybody today?
Well, I think lifestyle can do as much or more than medications. So, diet and exercise, we really need to look and wait. If we do that, I think you're well off. And then I would just add family history. If there's a tendency in your family to early heart disease, you need to go beyond these and see a doctor, and they'll do these other measurements as well.
Okay. Then they can start with their personal physician.
Exactly.
If they need more of a specialist for the heart
Yeah,
area.
start with your personal physician. They can measure your blood pressure and your cholesterol. And then if there are special problems, or if you have heart disease, then a specialist might be useful as well.
Okay. Dr. Anderson from the Intermountain Heart Institute, we appreciate you joining us today. And we'll stay tuned for next month. We'll have another topic posted and another webcast, so be sure to tune into our Facebook page to get updates on that. And appreciate you joining us today.
Happy to do it.
Thank you.